Hi everybody, I'm Dr.Tuti Huseynova and I welcome you again on my channel, Dr.Tuti. The presentation today I'm gonna present about extraocular muscles anatomy, and this topic consists of a few parts, so this is going to be a first part of this presentation. So, embryology of extraocular muscles. The fibers of the striated extraocular muscles originate from condensations of cranial mesoderm, whereas their associated connective tissues and the orbital smooth muscles, SMS is going to be later the abbreviation, originate from the neural crest. Myogenesis, there is a primary and secondary. Primary myogenesis is on 11 weeks, which brings a formation of the trochlea and the soft pulley. Secondary is a formation of periocular connective tissues. Let's just talk about all the structures and all the important structures of the extraocular muscles in the following slides. So, internal structure of the extraocular muscles. The ocular rotary extraocular muscles, although not the levator pulvivorus superioris, consist of two distinct layers. The orbital fibers insert into two distinct layers, orbital layer and global layer. The orbital fibers insert into the pulleys of the horizontal recti, and the global fibers insert into sclera. Origins and paths of the extraocular muscles. First of all, let me just briefly tell you which extraocular muscles we have. There are two types of extraocular muscles, rectus muscles and oblique muscles. So for rectus muscles, it's medial, lateral, inferior and superior, and oblique muscles also inferior and superior. The rectus extraocular muscles originate in the orbital apex from a common fibrous ring surrounding the optic nerve called the annulus of Seine. The superior oblique muscle originates from the periorbital of the superior nasal orbital wall. About each muscle I will talk later, not in this presentation, but in the next part of this presentation, where I will describe the surgical anatomy of extraocular muscles. So, superior oblique muscle, as I said, it's not being originated from annulus of Seine, as well as inferior oblique muscle, which originates much more anteriorly from the periorbital of the inferior nasal orbital rim, adjacent to the anterior lacrimal crest. And this is just a slide with a picture where you can see all these muscles. Next important structure of extraocular muscles is pulley. Here in this slide on the photo you can see the pulley ring, pulley sling, and let me just describe in the following slides what pulleys are actually. So let's imagine that this is an orbit. Pulleys consist of discrete rings of dense collagen encircling the extraocular muscles and are about 2 mm in length, coaxial. So these are pulley. So pulley has less substantial collagenous sleeves around the extraocular muscles anteriorly. These sleeves thin to form slings convex to the orbital wall, and more posteriorly, the sleeves thin to form slings convex toward the center of the orbit. And the anterior pulleys, slings, are also known as the intermuscular septa. It's pretty obvious during surgery, we can see this intermuscular septum. And the collagenous pulley ring forms the fulcrum of the pulley that inflects the extraocular muscles path. So what are pulleys' function? The pulleys function as the mechanical regions of the extraocular muscles and play a vital role in ocular kinematics, as well as subscribing for Listing's law, Donder's law, Sherrington's law, and Hering's law. In this presentation, I will talk about Donder's law and Listing's law. Other laws like Sherrington's law and Hering's law, I will talk in the second part of this presentation, where I will be mostly focused on the surgical anatomy of extraocular muscles. Donder's law. What is about? Donder's law is stating that there is only one torsional eye position for each combination of horizontal and vertical eye positions. The extraocular muscles have the ability to move the globe of the eye in 3 dimensions. Those directions are 3D eye movements, yaw, side to side, pitch from front-back movement, and roll clockwise, counterclockwise movement. Listing's law, a specific case of the more general Donder's law, states that any physiologic eye orientation can be reached from any other by rotation about a single axis, and that all such possible axes lie in a single velocity plane, listing plane. On the photo of this slide, on the right image, we can see a listings plane. Listing's law is satisfied if the axis of ocular rotation shifts by exactly 1/2 of the shift in ocular orientation for any eye movement. This is the so-called Listing's half angle rule. Here, for example, we can see this half of the shift during convergence or divergence movement of the eye. Shifts in horizontal rectus pulleys position required to maintain the Listing's half-angle relation in tertiary positions of adducted elevation and adducted depression. So about the movement of the eyes, I will also talk in our second part of this presentation where I give a description about the secondary, primary and tertiary movements of each muscles. So in this Listing's half-angle relation, it relates the tertiary position of adducted elevation and adducted depression. And paths of global layers in this photo you can see in black lines, and orbital layers inserting in pulleys are shown in gray, and pulley suspensions are also shown in gray in a shape of zigzag. So there is sometimes also a shift of pulley location, anatomically, structural. I don't know if we should say it anomaly, but probably it's not a normal anatomical location, because it brings some, as a result, to strabismus change, and they can cause pulley cause V and pulley which cause A pattern. So this is a pattern of strabismus, and this in this slide you can see the schematic location, or let's say like shift of pulley location. Anatomically, so this is a combination of upward displacement of the lateral rectus muscles and downward displacement of the medial rectus, which leads to A pattern strabismus. And this is a V pattern strabismus, which causes a combination of downward displacement of the lateral rectus muscles and upward displacement of the medial rectus muscles. There is also a term like a pulley zone or muscle pulley system. Here, for example, during the surgery, we can see this white zone and at the junction of the middle and posterior third of the globe, similar to Listing's plane. So this is a so-called pulley zone. The same we can see a schematic picture in this slide. The functional origin of the rectus muscle is at the pulleys, as I said already, and in the right photo on the right we can see this pulleys. This photo is from above, that's why the A is medial rectus pulley and B is lateral rectus pulley, and it's also clearly visible here. On this slide, so there are a muscle tendon system which is anterior to the pulley. So this red line, let's say that it's a pulley, and as you can see that when the eye is in a primary position, then this muscle path is straight. In upward gaze, it causes the muscle fibers are in upward and courses downward in down gaze. So the direction of the muscle posterior to the pulley, as you can see on the slide, doesn't change during up and down gaze. So the fibers just behind this red line, which I showed you, is, as you can see, they don't change in a position. But in front of this red line, the fibers of the muscle are changing depending on the movement of the eye. So why we don't see the pulley during the surgery? So here in the slide, the reasons that the strabismus surgeon is not likely to see the pulleys are several. The first is tenon capsule. Surgery of the extraocular muscle is carried out beneath anterior tenon capsule and in the plane of posterior tenon capsule. You can see here an anterior tenon capsule during surgery. The second reason is extracorneal fat. Dissection carried posterior to the origin of anterior tenon capsule will expose extracorneal fat, which both complicates surgery and obscures the surrounding anatomy, including the pulleys. And the third reason, I just didn't show it in the slide, but I will tell you that the third reason, although the pulleys are located in the orbital fat just behind the insertion of anterior tenon capsule, they are virtually impossible to identify for what they are. So, scleral insertion of the extraocular muscle. It's, of course, it's individual from patient to patient, but there is like an average number and distance between the scleral insertion of the extraocular muscles, which is the anatomic relations of rectus muscles insertion to the corneal limbus. And as you can see on this photo, the closest muscle to the corneal limbus is medial rectus muscle. The distance is between 4.5 and 5.5, but it varies, of course, from patient to patient. And the furthest muscle is superior rectus muscles, which is from 6.7 and sometimes till 7.5. Except extraocular muscles, which I described already, there are also smooth muscles of the orbit. And here in the slide you can see the list of smooth muscles of the orbit, which are the inferior palpebral muscle, the superior palpebral muscle, orbital muscle, and peribulbar muscles. Physiology of extraocular muscles. So there are key traits of muscle function. It's a contraction speed and fatigue resistance. Contraction speed is being perceived with the proteins which are expressed in a given muscle fibers. And fatigue resistance is a direct consequence of cellular metabolism. Let's just tell me, let me just now describe you what is the physiology of extraocular muscles is about actually. So the contractile unit of a skeletal muscle is a sarcomere. End-to-end sarcomere forms a striated muscle. End-to-end sarcomere is known as myofibril, and myofibril are being separated from each other by a membranous calcium storage system. It's a so-known sarcoplasmic reticulum. A sarcomere is the region from one Z line to the next Z line. M line hold myofilaments in place to maintain the structural arrangement and layering of the myofibril. There are additionally two main types of filaments: thick filaments and thin filaments. Each has different composition and locations. So here in the slide, it's just a reminder. So now we know that the contractile unit of a skeletal muscle is a sarcomere. And end-to-end sarcomere forms striated muscle. And there is also two types of filaments from the sarcomere: thick aggregates of myosin, lined and heavy chains, and thin filaments, polymers and alpha-actin proteins. Additionally, proteins, they modulate the contractile process. Tropomyosin, troponin, and both are attached to the alpha-actin backbone. And strands of tropomyosin block the binding sites and prevent actin-myosin interaction when the muscles are at rest. So here we can see also a sarcomere, and I'm going to talk about the dark and light areas. As you can see here, one part is like darker and another is lighter. So dark anisotropic band, A band, contain actin and myosin, and a light band, isotropic band, or E band, I band, contain actin. There are also the central region of the A band looks slightly lighter than the rest of the A band and is called the age zone. Presents only myosin. The middle of the age zone has a vertical line called the M line and contains proteins, as you can see here on the photo as well. In this M line, in which accessory proteins hold together thick filaments. Both the Z disc and the M line hold myofilaments in place to maintain the structural arrangement and layering of the myofibril. And this is how the arrangement of actin and myosin filaments in a single sarcomere looks like. This was a short presentation about physiology and the overview about extraocular muscles in this presentation. The second part of this presentation is going to be basically only about the surgical anatomy of extraocular muscles, which we need to know during our surgical procedures. Thank you for your attention, and I hope you find this presentation very informative. I'm wishing you a good day. Bye.